The Social Health Authority provides coverage for a comprehensive package of services, including specialized care, critical illnesses, maternity, and other treatments that might not have been covered under previous schemes. This encourages hospitals to offer more services and treat a wider array of conditions. By covering a broad spectrum of services and having a wide network of registered providers, the Social Health Authority facilitates access to care for many Kenyans, increasing patient flow to community hospitals. Mama Palista Bonyo Memorial Hospital, having been recategorized to Level 3B hospital, has had its share of challenges.
We've not been able to admit patients since the e-contracting, they didn't give us any bed capacity. And that has meant that our patient flow has really reduced, and it has affected our community at large. We had patients who could come for drug refills, like diabetic and hypertensive patients who are not able to because the SHA has really affected them. Some are not able to pay the annual contribution, and a large number who are paying monthly cannot pay because monthly contribution is no longer accepted at the facility.
After hearing this issue of SHA, she said that she can't get that money, being that she had paid for SHA a whole year, and the husband said they can go to her, and we were to refer her to her. Nabire thieth to se thiedha to chulo pesa nikech sa kony to nowinjo bed ni pod anindo kae. Koro kanyal nindo nikech SHA ok oyienegi.
To kaluwore kaka nabiro ka, ayudo ka weche mag sa chendo, to mbele kancha abiro ka to ne ayudo ka ne gima ne konyo.
Even as a facility, we don't get some income at least to boost maybe the resources that we need, that needs money.
We cannot sustain ourselves, and even some employees at the facility are now worried because of the current situation. You come to work and there's no workload. Maybe you just sit the whole day. You see maybe 2 to 3 patients who do not even pay and cannot sustain the hospital.
After recategorization, Mama Palista Memorial Hospital cannot be able to admit patients because of limited bed availability. As a facility, we are trying to get back our access to inpatient space through the regulator and Social Health Authority, but it's taking longer than expected.
From the recategorization, our inpatient services were compromised. At the moment, we are unable to admit patients in our wards using the Social Health Insurance Fund because we are limited. As a result, we have a lot of patients who need inpatient treatment, and they have to pay out of pocket or we have to refer them out. This is causing a serious strain, and sometimes we are forced to admit and later waiver the bill if we see that the patient is unable to raise funds to cater for the same bills. The financial burden is on patients, and we are not able to chase patients away.
SHA has really affected us because as at now, we are only authorized to use it as outpatient, and inpatient we are not allowed, I think with some of their reasons, and it has affected us. So number of inpatient has really gone down. People are coming in, but after hearing the news that the SHA is not working as inpatient, we hope to refer them to the nearest facility of choice.
Even our pregnant mothers have really had a difficult time because these are patients we've had from first antenatal care, and now when they come for delivery, they get that they can no longer deliver using the SHA. So some come when they are fully dilated, we can't refer, and that means we deliver them and they can't pay meaning we waive them at a cost. The hospital goes at a very big loss because we can't refer a fully dilated mother to another hospital. That can be fatal.
Our license says that we are level 3A. That is a valid nursing home in Kenya. And we've been decategorized to a level 3B and denied inpatient rights to our services. This has brought a lot of conflicts with our patients, and my community is underserved, and a lot of them are unable to raise funds to this.
As a billing officer, we even have a patient in our ward, a male patient in the male ward, who is not able to cater for his bills. Initially, he thought SHA will cover for the bills, but now that he's aware that SHA can no longer admit him at the facility, and the relatives have disappeared after hearing they have to pay cash. Now he's been stranded in the facility for going 3 days now. And that means every day the bill is accruing.
Nayud accident Luanda ema nokela ka osiptal kae, but tiendano nohinyore gi kora be nawinjo gi wiya. Koro magi kuonde manohinyore e denda. Gimomiyo omiya discharge to pok adhi, naparo ni SHA nyalo konya tayudo ka SHA kare ok ti. Koro ok anyal afford the bill. Jo osetemo lakini pok gifaulu nyaka sani.
Because you see, the reimbursement model does not meet the actual cost of treatment given to the patients. And this is posing a great challenge in operations. We buy a lot of drugs. We have to buy food for the patients in the ward. We have to pay the human resource, the medical and non-medical support staff. We have to pay them salaries to keep this going. As things look, it is going to be really hard to sustain our hospital in the next couple of, I won't even be sure that we'll be able to sustain this until next month, unless we get great help or somebody tries to hold our hand or a miracle happens. The issue of the inpatients, getting our access back to inpatients, it's been on and off. And we are being taken back and forth with the regulator and the social health authority, and it's taking longer than we had expected. Reimbursements on the same are taking longer. We see a lot of even the former claims that we had. Some of those claims are being rejected with no sufficient reason for rejection. So this means even if you offer services, you are not assured that you are able to get paid for the services that you've offered.
We are appealing to our partners and friends for financial support as we still engage the regulator and social health authority for access of inpatient admissions.
We are appealing to our supporters outside there, both in Kenya, outside Kenya, Bonyos Kenya Mission and its friends. We are hoping to get, people coming in and help us bridge the gap so that we don't close down the facility or shut it down or send our patients away, because the reason we are here is to serve these patients who cannot access quality healthcare in Kenya. Anybody willing to come in one way or another, financial-wise, to pick up, medications, we have to get reagents for the laboratories to run. We need to see mothers giving birth to babies without the fear of not being able to pay bills, because this is causing mothers to go back to traditional birth attendants, risking the lives of their unborn children. So we are calling in for any support, whichever we can be able to get, to help us bridge this. As I know this is temporary, and we are looking forward to getting more support. And when we finish the fight in this, we hope to get financial support to help us bridge the gap to continue serving the people that need us the most.